Good morning, ladies and gentlemen. I'm Professor Adrian GADANO, responsible for the liver unit at the Hospital Italiano in Buenos Aires, Argentina. And my task in this outstanding meeting has been to give some light on the news in portal hypertension. And to summarize the 2 or 3 main concepts of this topic, I would like to say first that there's really new information in this area. For instance, taking into account the non-invasive measurements, fibroscan or transient elastography, to categorize patients with portal hypertension and to identify patients with clinically significant portal hypertension will be an important improvement, since we will able to identify those patients with a non-invasive method. Then concerning therapeutics, it's an important study, which is a PHC study that has been shown to improve patients with clinically significant portal hypertension when treated by beta blockers. The study showed that in patients receiving beta blockers, this could reduce by half the first event of decompensation, mostly ascites. And this is new information for these patients, because these drugs not only prevent variceal bleeding but also decompensation and death. So it's an important point that probably will be treated in the new guidelines. Last, I discuss a little bit about statins and anticoagulants. There are improvements on these drugs, still not ready to give formal recommendations. And finally, there's a refined indication of early tips in acute variceal bleeding. This treatment has been given or provided in the last years, but now we know better the candidates that benefit most from these early tips. That's within 72 hours after the episode of bleeding, and this treatment improves and decreases significantly mortality in these patients. So thank you very much.